the biggest tips I have for people who are interested in space medicine research or any type of research is just perseverance, finding good mentors. My name is Joshua Ong. I am a resident physician here at the Kellogg Eye Center, and I'm in my third year of residency. I'm a PGY3 in ophthalmology.
Awesome. So where did this all start? Take me back.
Yeah, so in terms of like coming into like in medicine in general,
medicine overall, where did it start?
Yeah, so I was from Columbus, Ohio. I'm not sure if I can say that on camera, being here at the University of Michigan. But in undergrad, I got involved with helping out in some like free clinics, and I just found that was very meaningful, working with the underserved communities in Columbus, Ohio. And so I worked with a few physicians in these free clinics, just kind of helping out as a volunteer. And so I really enjoyed, just like learning about the just evidence-based medicine practices and how we can help our communities through understanding and also teaching patients about the pathophysiology and how to, utilize those deep understandings of medicine and disease to really help their kind of prolong the quality and also improve the quality of life. And then so through that, got interested in some research as well, biomedical research. Initially, I was doing some glioblastoma research. But eventually, I had the opportunity to work on a space medicine research grant that was eventually funded by NASA.
Wow.
Yeah. So we looked at skeletal muscle atrophy in astronauts. As astronauts go into space, they lose muscles, and the thought it was initially that astronauts, when they're not using their muscles like against gravity, they kind of lose it. But our hypothesis was actually that there is actually a mechanotransduction pathway that leads to our skeletal muscles to atrophy. So essentially our muscles actually can sense that there's a microgravity environment, and because of that sensing, they can basically cause certain mechanisms to kind of atrophy. And I found that was like extremely fascinating. We worked with a huge team with biomedical engineers, mechanical engineers, physicians, everyone like that, and it was incredible. And we eventually launched that into space in 2019, and that was really, combining the clinical aspect of it as well as the research aspect of medicine. That's really what led me into entering medical school.
Right.
And and then so now I went to medical school. I was really interested in ophthalmology. So now here I went to medical school at University of Pittsburgh School of Medicine.
Okay.
Yep.
Cool.
Yeah. So there I was really interested in ophthalmology. I was one of the aspects of their medical school was that they had something called the Guerrilla Eye Service, which was essentially combining a lot of my passions in serving the underserved communities. So we would actually take ophthalmology equipment and actually put it all in a van. It was kind of like Tetris, because you can put ophthalmology equipment's really bulky.
Yeah, sure.
And we would drive out to Western Pennsylvania and see underserved individuals without insurance who didn't have access to an ophthalmologist or an optometrist, or even have insurance to really see an eye provider.
Yeah.
And we would find referable diseases such as cataracts, diabetic retinopathy, and things like that. And then essentially catching these diseases that are preventable, but unfortunately, if they go too far along, it becomes causes irreversible blindness.
Right.
Yeah. So ultimately, that was one thing that I really loved in medical school, and kind of solidified my love for ophthalmology.
Yeah.
And then I was really fortunate to combine and merge my clinical interest in ophthalmology with my research interest in space medicine. And a lot of my focus is on spaceflight-associated neuro-ocular syndrome. I was fortunate to, work with a lot of people at NASA on that in medical school and also now. And unfortunately, it's one of the largest physiological barriers to spaceflight, future spaceflight, including the mission to Mars. It's considered a red risk.
Right.
So understanding a little bit more about this specific phenomenon is really important for upcoming space missions to optimize and protect astronaut vision. So that's kind of, ultimately I love the clinical aspect of ophthalmology. I love the surgical aspects, of ophthalmology. The classic example of a grandmother being able to see her grandchild clearly for the first time after cataract, post-op day 1 of cataract surgery. I found that was incredibly meaningful. Obviously, that's not the case for every single surgery, but I found that absolutely meaningful. And then also the research aspects of it. Like there's a lot of visual aspects of space flights that are really important and pertinent to understand. So. And that's led us to here.
Wow.
Yeah.
That's an amazing journey. When you were in undergrad, you started out with Did you start out with ophthalmology immediately in undergrad, or was it more just the space side, and then the ophthalmology came after that?
Yeah, so one thing that I wanted to do was really diversify my understanding of medicine.
Right.
So a lot of my experiences initially were in primary care, where we were working in the underserved clinics. But I also shadowed in like cardiothoracic surgery, orthopedic surgery, and I shadowed in ophthalmology before I went to medical school. And there was one experience that I tell almost like everyone when they ask me ophthalmology.
Yeah.
So this was the first time stepping into ophthalmology clinic. It was with a retina specialist, and it was a great day. We were doing laser, like I was watching lasers, seeing injections, intraocular injections, and the physical exam. And I absolutely loved it, and the retina specialist saw that I loved it. And he said, at the end of the day, he sat me down and he said, you know, Josh, if you gave me $20 million, I would come to work the next day because of how much I love ophthalmology. So you got to really consider it. You know, it's a competitive specialty. You want to, you know, learn about it, how to be competitive for it, for the match and things like that.
Yeah.
So yeah, that really led me to explore the field more.
Sure.
And I feel like when I was able to shadow a bunch of, you know, physicians, everyone loved their field for different reasons and specific reasons. I was able to find ones that resonated with me, and so that kind of led me to explore ophthalmology and other fields in medical school. But yeah.
So what were the reasons for you that actually like made ophthalmology stand out?
Yeah, so I think the biggest thing is the improvement in the quality of life. Almost everyone values their vision, and it's how we interact with the external world, it's how we interact with our loved ones, and see our loved ones and see everything, experience everything. And so when we lose vision, it can be very, you know, it can be a lot for patients. And so I found that ophthalmology has such advanced technologies and advanced procedures, such as cataract surgery, where we can take out cloudy lens, put in a new clear, crisp lens, and they can see clearly, even, you know, as early as post-op day one.
Right.
And I would say that now being in ophthalmology and seeing my post-op day ones, and you know, some of them are tearing up from, you know, how much better they can see. And definitely when I was a medical student, that's what really resonated with me. And then even to this day, I am very, very happy with that choice.
So it's that impact on the patient's life. Right?
Exactly.
That's amazing. What impact would you say it's had on your life, you know, choosing this path?
Yeah, I think that's a good question. I would say I'm very grateful, very grateful for my vision. I'm very grateful also that to be in this field. I
imagine it's advancing almost like every day, right? I imagine the field's not the same as it was 10 years ago.
Exactly. So it's, you know, and even with the spaceflight associated neuroocular syndrome, we didn't know about it 20 years ago. But astronauts were, you know, kind of saying some of these symptoms, and now with new technologies, such as that we're able to bring onto the International Space Station and things like that, we're kind of able to understand it a little bit more. So, but yeah, I think that it just, you know, it makes me really grateful to be in this field too, and it makes, I think, you know, it's a long journey, undergrad, medical school, residency, fellowship. But if you find a field that you really love, I think this is just applicable to all pre-meds, right? I think there's some of my resident friends that are not in ophthalmology that are like, oh, I can never do ophthalmology. And I think, you know, it's really just about finding the field that is best for you.
What makes you get up in the morning, right?
Yep, exactly, yeah.
So talk to me a little bit more about what you did with NASA, like what your role was as an undergrad, and then moving into later. How did that role evolve, and how did you contribute to those projects?
Yeah, so I would say that you know, I think that the biggest thing before I get into that story is really just trying to be good at the task that you have at hand.
Right.
So initially I was doing brain cancer research. I had been doing it in high school, and I was in the Columbus area, and then I continued that into undergrad. And I was very fortunate to receive a few scholarships, and I remember working very late as a pre-med student, you know, coming home at like 1 a.m., 2 a.m. doing, you know, bench research. But you know, eventually there was a professor that had come from California in cardiothoracic surgery, and he was looking to build a team to kind of work on a NASA grant. It's going to be a large NASA grant for a suborbital spaceflight mission. And ultimately, he had heard about me through some of the work I'd been doing, which was nothing related to you know, brain cancer, or the work that he was planning on doing was nothing related to brain cancer. But I think he was looking for people, for pre-meds or individuals that could do just good work. Yeah, I eventually, I interviewed, got the position on the team, eventually became team lead as well. And we wrote the grants. We ended up getting the grants, and that was one of the primary reasons why I ended up taking a year after undergrad to kind of just continue that research. And I was working with a lot of biochemical engineers, mechanical engineers, and just like with physicians. And eventually what we did, actually, this research was we tissue engineered bioartificial muscle and put them on these little electrical prongs, And essentially these bioartificial muscles became scaffolds. We put cells and then we kind of gave growth factor for them to grow into actual little muscles.
Right.
And these they were on these little probes. These electrical probes served as had two different purposes. One of them, they were a force transducer, so we could see how much they could contract.
Right.
And the second of all, they were electrical stimuli. They provided electrical stimuli, so we could actually electrically stimulate them to contract. And so what we did was we had a ground control and stimulated them, and then we sent them into space.
Wow.
And then also, when they sensed microgravity, they would also contract as well.
Oh my gosh.
Yeah. So that was kind of like my foray into space medicine. And then after that, in medical school, I was really interested in ophthalmology. So I was very fortunate to kind of like co-write another grant and receive a grant looking at corneoscleral absorption of topical drugs in microgravity. And so we got funded by NASA again for this. And we were essentially developing and going on a parabolic flights. So like kind of, I think just like in general terms, like layman's terms, like the vomit comets, but it's like one that you go in microgravity for just a little bit, and we're going to see how topical drugs absorbed in like a bovine eye. And we had it all set up. We were about to, go on the flights and sign the papers to go on the flight, but eventually COVID hits, unfortunately. So. But I think one of the biggest things, especially as pre-meds and in my journey, is perseverance. So even though COVID occurred, essentially everything kind of shut down. We were unable to get good tissue for the thing. Everything kind of was basically came to a stop, especially for that type of translational basic science research. I reached out to other people in doing work in ophthalmology and space medicine ophthalmology, and that's how I kind of got connected into the spaceflight-associated neuroocular syndrome kind of field.
Right.
So, and then I started working with, especially one professor, Dr. Andrew Lee in Houston Methodist, and he's been a really great mentor of mine now. And we were able to work together, and we've worked with a bunch of people at NASA and across the world, and eventually we published the first textbook on the subject. So we published that. Yeah, so that's been really great. And now I'm working on a few things. Some of my work is developing machine learning frameworks and also head-mounted applications to kind of help characterize this disease a little bit more. Because unfortunately, even though it's a large barrier to future spaceflight, the underlying pathophysiology is not really well known. And there's really no terrestrial equivalent to it.
Right.
So you can imagine that we can only study, the N is just so small because it's only astronauts. So developing terrestrial models or mathematical models and really just thinking about the hypotheses, really thinking about the anatomy, the physiology, and and so that's kind of my, everything that's kind of been around the space medicine realm. Yeah.
Wow, that's amazing. How are you working on that today? Like I imagine, being a resident, like a lot of your time is invested toward just training to be a doctor, right? So how are you continuing that work today, or how are you managing those two?
I'm really happy to be here at the University of Michigan. I think that the Kellogg Eye Center, especially when I was interviewing at residencies, there are really amazing residencies all across the nation. But I felt very, very supported in what I wanted to do in my research endeavors, and I think that as a resident, I think the biggest thing is learning how to be a good clinician, and I'm very lucky that during some of the free time that I have as well, I'm able to kind of continue some of the research work that I've been doing, and it's really about collaboration. So I'm not the absolute best at machine learning or developing coding or like working in Python. So I work a lot with engineers, just across the nation and things like that. But one of the things that we can do is kind of understand the pathophysiology, understand what tests we want to do, understand what type of imaging we want to analyze, and really providing those clinical aspects of it. So one thing I learned through this whole space medicine thing, because we have a network of researchers all across the nation, and we're kind of working on this together. And it's really about teamwork. And that's my initial foray into it was with my NASA grants in undergrad, where I was working with a bunch of engineers as well as physicians. I kind of learned that, it really takes a whole team to really pull this off. So, yeah.
What would you say was the hardest part about, asserting yourself into this field as like an undergrad, where it's like, you might feel as though everyone else around you knows more than you, or, it's really hard to, get a footing into such a perhaps intimidating, right? Working with NASA, working on a NASA grant. Like, how did you, reassure yourself that you'd be able to take on the various challenges that come with this kind of research?
Yeah, that's a good question. I would say that, the first thing is having good mentors. Yeah, that's really the number one foremost thing. I would say that, it's perseverance.
Right.
So I think that being out here in the Midwest, there are multiple times I've been told, like, space research only occurs, in Houston, in Los Angeles, where SpaceX is, right, in Florida and things like that. And so I've been told no a lot of times, especially, it was a lot during, undergrad when I wanted to get more involved with certain other things.
Right.
I think that's so having a good mentor, the mentor who came from California, it really opened up my mind that like space research can be done anywhere, but it's really the perseverance. And so when I was an undergrad, I applied for a few grants internally or externally, and a lot of the times were just like, this is just too niche of a topic. It's too, this is not something that is really done here, which was unfortunate to hear. And the backing behind a lot of the rationale made sense because you need to fund something there. So eventually finding mentors that believe in you, that have the resources and can provide some guidance is really great. And so I think that's like the biggest tips I have for people who are interested in space medicine research or any type of research is just perseverance, finding good mentors.
Yeah. That's awesome. And so going forward, you said that you're on your third year of residency. There's still a little bit more to go. What's the plan after residency?
Yeah. So definitely, I think I'm very interested in fellowship. In ophthalmology residency, for fellowships, there's like cornea, glaucoma, retina, pediatrics, neuro-ophthalmology, and definitely a few others. And so right now, I'm still figuring out exactly what I want to do clinically for the rest of my life. I would say that actually choosing ophthalmology is a lot easier. Choosing ophthalmology as a residency or a subspecialty is so much easier than choosing the fellowship because you're really locked in for the rest of your life. But I think one thing that I know for sure is that I want to continue doing the space medicine research in ophthalmology.
Right.
So no matter what I go into, really taking that specific field, subspecialty field, and really analyzing it for my future career.
Right.
Yeah.
That's amazing. Yeah. And then hopefully you have the opportunities and the mentors to support you in taking those decisions, right? And making those steps. What advice would you give to someone in my shoes, for example, who doesn't really have a footing yet in research and is looking for that kind of niche? And I know you mentioned, finding a mentorship. Is there something about, choosing a topic that speaks to you? Like, what would you say?
Yeah, so I think, I was very fortunate to serve on the admissions committee for my medical school, as well as just like mentoring a lot of pre-medical students.
Right.
And also being a pre-medical student myself around 7-8 years ago. And so I would really say it's about finding your passion. I know it sounds a little cliche, but exactly what you said, finding something that really speaks to you. I would say that, a good pre-medical applicant is very well-rounded already. But one that really stands out is one that has built a kind of a brand or like a point, right? Someone that is really, really passionate and it really shows. So I think that's honestly the one thing. Obviously getting a good GPA, getting a good MCATs, everything like that, having good letters is really important. But really having a brand, so you can be really passionate about technology, coding in medicine, AI in medicine, something like that, and showcase, starting doing a lot of things in there, having publications in that realm. I think, sometimes I think I've seen some pre-medical students, they, are checking off all the boxes and get really exhausted, because it is a really exhausting journey, and I feel that. So definitely being well-run is important, but really thinking, what am I really passionate about, and not just checking off the boxes. And it will really showcase through your application, and it will really showcase through the interviews as well.
Right.
Yeah.
Yeah. And then you had the privilege of, making space medicine, right? And ophthalmology, making that your brand. Right? That's incredible. Going forward, I'd love to ask you a couple questions about your research as well.
Yeah, absolutely.
I saw on LinkedIn, there was something about like the Apple Vision Pro.
I'd
love to hear about that. What was that project?
Yeah. So one of the developments that we're working on is developing these head-mounted technologies for astronaut vision. And so we're developing these, we kind of call it agnostic software, because we don't want it to put into one specific hardware, because, but we are developing these, it's basically this like a NASA project where currently astronauts are doing a visual acuity test, when you're reading the lines there, and that they're using a laptop computer, and it takes a lot of time. And unfortunately, visual acuity is only, while it's a really great metric, it's only one sole component of like understanding of the whole visual function. So the technologies that we're developing for possibly Apple Vision Pro, maybe it would be with Oculus, but really, and one of our roles is also to look at the technologies here terrestrially and see which one's best for space flights. But really, this is a head-mounted device that we're hoping maybe Apple Vision Pro, and so that's why we're looking really into it. Is basically putting a lot of visual tests on this device, and then basically they can flip through it really, really, really quickly. And this is going to revolutionize, at least we believe it's going to revolutionize, our understanding of how spaceflight and microgravity affects the human eye, essentially. Because there's so many things. There's like visual acuity, dynamic visual acuity, contrast sensitivity, color sensitivity, visual field perimetry, which is like your visual field test. There's so many tests that can kind of help characterize visual function, and we don't have access to that right now, but that's where our work is going. And the Apple Vision Pro is a great piece of hardware, has a lot of great specs, and so we're really excited about it when it first came out, and looking at how it can be, how our software can also be implemented to it.
I imagine ideally you'd have some sort of like custom built, piece of hardware or equipment that is, made specifically for that function of, characterizing the human eye in all the ways that you mentioned. Is that something that's in the works as well, or potentially? Yeah,
I think a lot of our work right now is software. I think that there's so much good hardware already available, but I think it would be modifiable for sure. And so working with the actual companies themselves. So I don't think I can disclose exactly which companies we've talked to, but we've talked to a few companies, and I think everyone's pretty excited to hopefully bring something into space, and we're excited to do that. And one of the things also is that we're hoping to, as we did a lot of work in, the space environments, one thing I'm also very passionate about is leveraging a lot of these advances and these novel technologies for also our underserved communities. This really brings it back to what brought me into medicine in the first place. So one of the things that I noticed is that there are parallels between the limitations of space in the spaceflight environments and our most underserved communities, such as there's like a limited access to medical care or medical providers, limited access to medical imaging, limited access to medical therapies. And when I was out in the Gorilla Eye Service, serving patients without access to these, and I'm also building these technologies to kind of help circumvent some of these limitations, such as machine learning frameworks that can help to detect, detect like pathology before, because it might take some time before we can capture it on imaging. I started to realize that we can use a lot of these novel technologies for space flight to actually advance human health on Earth, and so that's really also one passion that I have a lot with this project. Is we are helping to protect astronaut vision, which is one of my passions, but also can we take these light footprint technologies, right? Because space flight, just the ISS is so compact. We have to make it compact. We have to make it lightweight. Can we take these technologies and bring it to our most vulnerable communities?
So you're advancing two frontiers sort of at the same time.
Yeah, exactly. Yeah.
That's amazing. That's amazing.
Thanks.
Talk to me a little bit about the artificial intelligence and machine learning side. You know, I saw a couple of those papers are sort of referencing that topic, and it's a hot topic now.
Yeah. So I would say that machine learning is, and deep learning and just like AI in general has really revolutionized medicine. And so I definitely recommend for any pre-med students and medical students to just be a little bit, to like read up on the topic and to really be aware of it. We don't have to, you obviously don't need to get into coding, but I think it's going to really revolutionize just how we can optimize medicine. But there's also a lot of considerations, and there are a lot of risks that we need to take that into account as well. But a lot of the work that we have been doing is, there's like two fronts. One is detection. So detecting spaceflight-associated neuroocular syndrome earlier. And this is really helpful because if you're on a mission that is moving away from Earth, your transmission time is going to be longer. And these fundus images, or these optical images that we're taking, are very high quality. So as we move away, it's going to just, the transmission, there's going to be a transmission delay, which is going to be significant as the further and further and further we move along. We'll be going beyond Mars or things like that. So, but it's really important to catch this earlier on. So if we can have a machine learning framework on the space, either on the International Space Station or on a space shuttle going to Mars or something like that, that can help detect the pathology that's occurring, then we can implement countermeasures a little bit sooner. So we have optical coherence tomography, which is an imaging modality on the International Space Station already. And that kind of helps us understand a little bit more about SANS, which is the kind of short abbreviation for space-associated neuroocular syndrome. So that's one front. And then the other front is that, kind of like what we talked about, is that there are a lot of limitations to medical imaging on the space station. So there's no MRI because we can't have any metal and everything like that. Another thing is that we actually can't have access to a lot of like contrast-based imaging. So here on Earth, we kind of take it for granted. We get blood draws, we do contrast-based imaging for like MRIs and things like that, or angiography images. And we kind of take that for granted because we just kind of do it. But in space flight, if you are in that like 1 in 10 million patients, that person that has a complication, it's really, really bad. So there are a lot of limitations. So blood draws are, that's something to be careful about, but also doing contrast as well. So there's a specific modality called fluorescein angiography here on Earth that we do quite a bit to understand the vasculature of how the human eye is perfusing. And on spaceflight, we don't have access to that for two reasons. Well, we don't have like the imaging modality for that, but more importantly is we don't put contrast into astronauts. It can cause, unfortunately, a lot of problems for their kidneys, for whatever, or just like they might have an anaphylactic shock or allergic reaction to that. Even if it's really rare, you just don't want to take that risk. So we actually have developed something called a generative adversarial network that basically takes a non-invasive imaging modality that is already available on spaceflight, and we actually generate another image of it that is similar to the angiography images here on Earth, so that we can further understand how microgravity impacts the eye. And so this kind of brings it back to this whole, serving our most vulnerable communities. So pregnant women, infants that are really sick, patients with end-stage kidney disease are unable to also get contrast as well. So this technology is also something that's very powerful that can really help these patients as well.
Wow. So that's amazing. That's really interesting. It's hard to imagine that these are also things that you have to think about when you're in space, like taking care of these astronauts. And I know you mentioned that there's very limited interventions that you can perform in space when you have these sorts of things going on. What are some of the interventions that are currently there, and then how would you say those interventions would change in the future? Yeah,
so right now we know that there's some research about how certain vitamins and also genetic dispositions can increase the risk or the odds ratios for developing this. So we also know that low B vitamin status can also increase your risk for developing it. There's a lot of great research coming out of Houston in terms of like analyzing astronauts that developed this. So actually, B vitamin, I've talked to the researchers who are, doing this. We're very fortunate that they contributed to our textbook for a chapter, and in that chapter they kind of talk about they have some concurrent ongoing research on utilizing B vitamins as a countermeasure for this. Other countermeasures is it's called lower body negative pressure.
Okay.
So one of the hypotheses behind spaceflight associated neuroocular syndrome is that there's a loss in hydrostatic pressure. So hydrostatic pressure is defined by density times the gravity times the height of the person.
Okay.
So in weightlessness, or in microgravity, we kind of reduce microgravity, so there's a reduction in hydrostatic pressure. And so when we stand on our feet for too long, eventually our legs get swollen, right? But then when we're sleeping and we wake up, our face is puffy. And that's a very similar concept because when we lay down, there's something called a cephalid fluid shift. Cephalid means head, so there's a headward fluid shift. All the fluid in our legs, that was kind of brought down by hydrostatic pressure, comes towards our face.
I see.
And microgravity is a similar way. But eventually, you and I, we wake up and then we get up, right? And the fluid comes back down.
Right.
And for astronauts, there's nothing like that, right?
You're stuck there.
Yeah, you're stuck there. And then so the fluid is up there for an extended period of time. And so the thought is that, with this hydrostatic pressure, maybe it can raise your intracranial pressure, maybe it can cause venous stasis, things like that. Maybe just, there are a few hypotheses, and we're very fortunate to work with a lot of the people kind of that came up with these hypotheses. But one of the things that we looked at, and it's actually the Russians are actually they brought one up to the International Space Station. So there's a lower body negative pressure, which is essentially you use only on the lower body. You use negative pressure, and you're basically actually bringing the fluid back down. It's really interesting. You're bringing the fluid back down, and so that's a really interesting countermeasure. And there's some work coming out of University of California, San Diego about building a mobile lower body negative pressure, where astronauts would have it in their suits.
Yeah, in their spaces.
Yeah,
Wow.
So
That's amazing.
Yeah. So I think that it's really great because this understanding the countermeasures means understanding the pathophysiology behind the disease, and I think that's true for every realm of medicine. And so that's why our work is to understand this disease a little bit more, and so that researchers around the world can kind of help develop better mitigation strategies for it.
So you really are like on the frontier of this side of medicine, of space medicine. Do you feel like you have any like unique responsibilities as being like in this area where it's like there's not much known? You're really researching this new field, right?
Yeah. Well, I would say that the people who are truly at the front are a lot of my mentors out in Houston.
Okay.
And I've and especially there are some flight surgeons that are actually seeing the astronauts face to face there. And ultimately, maybe I don't know where life will take me, but maybe in Houston too. But it definitely is a drive to understand more. I feel like I've been very privileged and very grateful for the opportunities given to me.
Yeah.
And so ultimately, I want to take the knowledge and the experiences that I have to apply it to hopefully benefit astronauts and also benefit human health on Earth as well.
So all this work that you've done has been recognized by Forbes. So, and then you were on the Forbes 30 under 30 list, right? Talk to me about that. That must have been so surreal. Yeah.
I think I was very fortunate to be recognized by Forbes 30 under 30. And it's I was just kind of blown away by it. I think just from an overall perspective though, I think it's really great that we're that this kind of field of space medicine also, and like spaceflight associated neuroocular syndrome is also gaining a lot of exposure as well, and awareness as well. And also one of the biggest things I want to kind of also bring awareness to is how can we take the most the hugest advances in our communities and really advance them to use them to and leverage them for our most vulnerable communities. So. But yeah, I mean, it's been a really great experience meeting a lot of other, people on Forbes 30 under 30. I'm just like also very inspired, able to share my own story, and it's been great. Yeah.
Yeah, I love that that's also a priority for you to really bring it back to the vulnerable communities, because a lot of people might be thinking like, why are resources being, put towards something where there's such a small population, right? And then to your point, it can be applied to there's a lot of parallels, right? So that's really interesting that you're working on that. looking forward, like, do you have anything that you can, disclose, anything that's in the works right now that might be something cool?
Yeah, so I think that ultimately, what we're looking at, the back of the eye, which is where the optic nerve sits and where the retina is at, we call that the posterior segment, has been a huge, focus. One of the research avenues that we're looking at too is to look at now the front of the eye.
Yeah.
So everything is kind of like intertwined, and the fluid shifts are, something that is not completely well understood just because we have limited imaging. But what we're looking at now, we're really focusing on the front of the eye. We're focusing on the cornea, looking at the aqueous humor, hydrodynamics, and things like that.
Wow.
So that's some exciting work that we're trying to do, and then really just trying to be very comprehensive in understanding how microgravity affects the human eye. Yeah.
Amazing. Awesome. Yeah, I think thank you very much for your time and for talking to us a little bit about your work, your exciting work, and maybe we can reach out sometime in the future and see what exciting stuff you get up to.
Yeah, absolutely, and congratulations on all the hard work you're doing with this. It's really excellent.
Sweet.
Yeah.
Awesome.
Perfect.
Thank you, man.
Yeah, absolutely.